Hi, I'm Carl Hattingh. I'm a clinical psychologist and the director of the Milton H. Erickson Institute of Sydney in Australia. In this interview, I'd like to introduce you to Professor Mark Jensen. He's the Vice Chair for Research in the Department of Rehabilitation Medicine at the University of Washington in Seattle. He's also the president of the International Society of Hypnosis and the author of the award-winning book Hypnosis for Chronic Pain, Therapist Guide, which is a must for any therapist who wants to work with chronic pain. He's published 11 books, over 700 articles and book chapters. His work and research include work with chronic pain associated with cancer, low back pain, multiple sclerosis, and injury. Mark will be in Sydney from 8 to 9 September to present a workshop, Hypnosis for Chronic Pain. This is a hybrid event and can be attended in person or virtually. And now, without further ado, Professor Mark Jensen. How did it develop that you ended up spending so much of your life studying chronic pain and contributing in this way?
Yeah. Well, it was an accident.
Okay.
I intended to study depression when I went to graduate school, but the professor who I wanted to work with didn't have any room for more students. So I had to interview other professors to find out who I might work with. And pretty soon after I walked into Paul Carolli's office, I think I made some comment or quote from Monty Python sketch, and he came right back with it. And so we went through the sketch, and then somehow we talked about, we'd both seen Doctor Who the night before. And I said, yeah, I thought to myself, I want to work with this guy. And so I said, what do you study? And he said, health psychology. This was in 1982.
Yes.
What is that? That doesn't make any sense. I mean, we study the mind, not, psychological issues. Well, it's psychological factors related to pain and health conditions. And he said, read some of these books. And I read the books and articles, and I became fascinated. And it was clear, psychology's contribution to managing chronic pain was just starting. And I realized there's a lot to learn. I could make an impact, and it was just interesting. And my interest has never stopped. Yeah, so I've been studying. I basically devoted my whole career to understanding and treating pain. That's it. So I was told early on, don't focus so much. You should be broad. I will not. I'm interested in pain and the relief of suffering. That's what I'm going to study. And it's okay to study one thing. There's plenty of room to learn, and it's turned out that becoming having so much knowledge in this one thing has been useful. I think I am able to be of greater assistance rather than having a little knowledge of a lot of things. So it's been okay to study one thing.
And so a lot of the research show that hypnosis is efficient or is very helpful as part of the treatment of chronic pain. And I was wondering if you could just comment.
Yeah, well, it's subtle. It's interesting. The outcome is variable. Not everybody benefits from hypnosis treatment for chronic pain. Now, I have colleagues that argue, saying, "Oh, everybody benefits," and so if you broaden what you mean by hypnosis, then of course everybody benefits. But the kind of classic hypnosis, not everybody benefits, but some it's life changing. And what's important to understand, I think, is for whom it's going to be most effective, identifying the hypnotic suggestions that are going to target what's going to be most effective for this person, and to understand when it's appropriate to move to another strategy, such as cognitive behavior therapy, where you engage the person and actively engage their frontal lobes in a conversation. And that's the route in to change things, or teaching people meditation. So an excellent clinician doesn't just do hypnosis, but an excellent clinician always has hypnosis as part of their toolkit.
Now, the part that I'm really interested in, that you will be talking a lot about in the workshop, is different areas of the brain, different functions, neural pathways, and how that helps a clinician to decide what kind of an intervention, what kind of suggestions they're going to use in their intervention.
Yeah. Well, a dog has a whole lot of the brain devoted to smelling, a whole lot. We have a whole lot of our brain devoted to feeling pain. It's easy for our brains to feel pain. And in fact, we have to survive. A healthy body feels pain. So the issue, of course, is when the brain becomes oversensitive or experiences pain when it really isn't that helpful for the person. And that's the situation with chronic pain. So there's so much of the brain involved in the creation of this experience that understanding that, and then understanding how to do an assessment to identify for this patient what's going on where, so that I can target the suggestions to address that. So just like you shouldn't use only hypnosis with every patient, you should not only use one suggestion to address pain with every patient, because you will miss great opportunities to really help this patient. So understanding how the brain, it creates that experience, what parts of the brain are involved, and then how to target those processes with specific suggestions can help boost the efficacy of your intervention.
So there's this tailoring your intervention.
Another reason to go this route is that some people are afraid of hypnosis. They think it's magical or hocus pocus. But when you talk about it and understand it in terms of its biology, its neurophysiology, you understand that hypnosis is a biological intervention that has science behind it. And when patients understand that, it helps them, I think, use hypnosis more effectively, and it's less frightening to them. So that's another reason to kind of go at it from this approach, I think.
So you don't have that much experience in hypnosis, or you haven't been trained in hypnosis. What would one find in the workshop that could be helpful to start on this journey?
Well, I would hope that you would learn some basic inductions. I usually go over my favorite hypnotic inductions for pain management. They're simple, and I like simple. And you would learn about the neurophysiology of pain and how hypnosis and hypnotic suggestions impact that, so that you could use hypnosis in your practice. You'd learn some basic suggestions and skills for increasing a person's sense of control over their comfort, and also learn about different pain conditions specifically, and how you use hypnosis differently for each pain condition. My goal when I go to workshops as a participant is to learn some things that I can start using immediately. And so I design the workshops always so the person, on the Monday after the weekend, can start doing things differently. And I also target the practice sessions and the information in ways to boost the participants' self-efficacy and confidence that they can do it. So there's plenty of time for practice. I always feel a little guilty that while the practice, I just kind of sit there and walk around and answer questions. It's not as much hard work. So I make the participants work. I feel like I should work harder, but because I have a lot of fun. But I think ultimately it's a more effective workshop when we organize it that way.
Which strategies or which other approaches participants can learn a bit more from, or that's helpful in the management of chronic pain?
Right. So I teach those in the context of a hypnosis workshop. So I think that it's important, if it's effective, to do motivational interviewing hypnotically and to incorporate motivational interviewing as a part of the treatment. And in fact, when it's done very well, for those people who know about motivational interviewing, it's really a type of hypnosis. If you read Milton Erickson's work, it's chock full of motivational interviewing strategies. And so he invented them in many ways, although didn't call them such. And the same with cognitive therapy. We found in our research that hypnotic cognitive therapy is more effective on average than standard hypnotic cognitive therapy. But the key to treating chronic pain is changing people's thoughts in response to pain, automatic thoughts. So it's not about pain reduction. It's about using strategies to change the thoughts so that the person has new and different adaptive automatic thoughts in response to stimuli that used to bring the experience of pain. And so cognitive therapy gives us ways to get at those thoughts that might be most effective. So I talk about those two strategies in the context of hypnosis. So if somebody doesn't have to know cognitive therapy or motivational interviewing to participate, but if they do, then they'll recognize how they can incorporate hypnosis in their work as well.
David, so we're really looking forward to welcoming you in Sydney.
Oh, I love Australia. I love coming to Australia. So I'm looking forward to, of course, Sydney's a beautiful city. I enjoy seeing the fruit bats in the botanical garden if they're back from the heat. And it'll be nice, wonderful to be able to spend some time with you as well, and to make new friends in the hypnosis community. I mean, part of what's important to me personally is enhancing the use of hypnosis around the world. So I love the international connections. So, it's going to be a virtual, hybrid workshop. So I anticipate we're going to be seeing participants from around the world as well, and I welcome that. But also it'll be nice to meet more colleagues there in Australia and Sydney, and to do what I can to promote the use of hypnosis in Australia as well.
The workshop is on the 8th and the 9th of September this year. And as Mark mentioned, it's a hybrid workshop, so you can attend virtually, but you're also very welcome to attend in person, which will be great. And you can click on the link below to register or get more information. Mark, thank you so much for the time and just telling us a bit more about the workshop. And we'll see you in Sydney.
Okay, looking forward to it.